Now we know what can cause cancer. Anything that causes cancer would be called as a carcinogen. I have already told you that cancer is essentially a genetic disorder caused by multiple mutational events. So anything that causes cancer would be called as a carcinogen. And please try to understand that all carcinogens are mutagens. So we are looking at mutagens, the agents that are capable of causing mutations, and try to ascertain the relationship of them with the agents that are capable of causing cancer, which are called as carcinogens. So what I am saying is that all carcinogens are mutagens with the exception of asbestos fiber. So that is probably the single exception that comes to my mind. Otherwise all known carcinogens are mutagens, but the reverse is not true. So please try to understand all mutations do not lead to cancer. So anything that causes mutation essentially does not lead to cancer. This is a very, very important thing to understand. Again, I am telling you all carcinogens are mutagens, but the reverse is not true. I hope now you understand what exactly is cancer, how it is actually caused. After understanding this, the next thing would be, what about the clinical picture, the sign and symptom? So obviously, as I told you in the beginning itself, that cancer can affect every part of the body, any part of the body. So that means the sign and symptoms that develop in a particular type of cancer will depend basically on the site in the body that is being involved. For example, somebody has a difficulty in swallowing. So you can think of probably maybe having cancer of esophagus. Somebody is having nagging cough. This would be cancer of lung, obviously. So this is some urinary symptoms. It may be in the urinary tract. So that means varied type of sign and symptoms can be present in the patients of cancer. They can mimic the common diseases very well, because anything that infects lungs will be causing cough and will be causing chest pain. It will cause the abnormal awareness of breathing or painful breathing, which is called as dyspnea. So that can happen in tuberculosis, that can happen in pneumonia, that can happen in lung cancer. So we do not have a set sign and symptoms about the cancer. Again, the basic fundamental to understand is that the sign and symptom will depend on the site involved. But there is a useful mnemonic that everybody should be aware of, some danger signals they call it, that a person must be not ignoring at all. And these things are, this mnemonic is called as a caution. So this is a very famous mnemonic. And caution, this C would be a change in bowel or bladder habit. So change in bowel or bladder habit. So that means there is sudden diarrhea, there is sudden constipation, all these type of things. This can be a early sign of a cancer. And in A would be a sore that does not heal. So there is a sore in the body and it is not healing. Say for example, an oral ulcer not healing in sufficient time. So that would be an early sign of a cancer. Similarly, there can be unusual. You would be unusual bleeding or discharge from any body orifice. So unusual, any bleeding or discharge, this can be a sign of cancer. And if you look at T, this would be thickening or lump in breast or anywhere else in the body. So especially important in cases of breast cancer. So very common cancer in females, breast cancer. So cancer breast and cancer cervix are very common in female. Overall, lung cancer is the most common cancer in the world. Now I would be an indigestion or difficulty in swallowing. So there is difficulty in swallowing. And O would be an obvious change in a mole or a wart. So there is a mole on the body, suddenly it starts bleeding. Say for example, it starts increasing in size. That may be an early sign. And N would be a nagging cough. Now please try to understand that these are the common signs that are present in other conditions as well. So somebody is having indigestion, maybe having a may have had a bad food. So it is not necessary that immediately somebody has indigestion runs to the doctor that I am probably having, say for example, stomach cancer. So it is not like that. It is not like that. Just the idea is that in a proper setting, these type of things, a smoker for 20 years, 25 years has a nagging cough which is not going. This is something to worry about. It is not that you go out in cold and have some cough and you think that this is lung cancer. So please try to be aware of these things. There is no need of panic. Again, I am telling you that all these signs and symptoms are common in other conditions as well. So a simple stone in the ureter, say for example, can lead to bleeding from the urethra. This is how it is the way to look at the things. In the proper setting, these type of signs and symptoms should not be ignored. The idea is that if you diagnose cancer early, then a lot can be done actually in the cure and treatment of the cancer. So I hope now you understand the basic clinical picture that you are going to see in the patient suffering from cancer. The next question obviously would be, sir, after understanding the clinical features, the signs and symptoms, how do you diagnose cancer? So there are so many techniques which will help you in diagnosing cancer. So mind my words, I am saying help you diagnose the cancer. Again, for example, it depends on the site. So you can do what is called as a chest x-ray. So you can do a chest x-ray to diagnose lung cancer, or to actually this will aid you in the diagnosis of the cancer. You can do ultrasonography. Please try to understand the expanded forms of these abbreviations that I am telling you. Ultrasonography, so anybody having some pain, abdomen, etc., undergoes an ultrasound. This is commonly called as ultrasound. And what can be done is computerized tomographic scan. This is called as CT scan. Again, magnetic resonance imaging. What can be done is fiber optic endoscopy. So an endoscope may be pushed, say for example, in the gastrointestinal tract. At the end there is a light source as well as a camera that sends pictures. Obviously some procedures can also be done. This is a very exciting development in medicine, the fiber optic endoscopy. Similarly, there can be positron emission tomographic scan, which is called as PET scan. You can obviously do the blood test, the hemogram, say for example, in the cases of blood cancer. All these things, they will tell you that yes, what you are thinking may be present, but cancer is definitively and finally diagnosed by histopathology. Now this is an important question. So finally the cancer has to be diagnosed by histopathology. That means you remove a sample of the tissue which you feel is cancerous from the body. You remove a part of it. This is called as biopsy. So you take a biopsy and you prepare a slide, stain it properly, and watch under the microscope. That will tell you what type of cancer it is, what is the tissue that is involved, what is the extent of the cancer, what is the grading system. There are various grading systems of the cancer, what is the stage of the cancer, and that will actually help you guide in the treatment of the patients of the cancer. So all these things can help obviously, but it is to be finally diagnosed by histopathology, taking a sample, as I told you, and this sample can be actually taken by fine needle aspiration cytology. So you insert a needle through under radiological guidance, and you take a sample of the tissue, prepare a slide, watch under the microscope, and diagnose the cancer based on your findings, what you see in the microscope. So this is how cancer is diagnosed. Now after diagnosing cancer, the main important part would come, that how do you treat cancer. Now the various modalities of the treatment available are surgery, then there can be radiation therapy. So I told you cancer cells are easily killed by radiation. So radiation therapy is sometimes the primary treatment in many types of cancer. Obviously the type that you choose, the type of treatment you choose also depends on the type of the cancer that is diagnosed. Similarly, there can be chemotherapy. This is the use of antibiotic drugs, and this is chemotherapy. And an exciting thing would be, a new development would be immunotherapy. So this is This is a very exciting development in the field of treating the cancer. Now, just to understand this, that surgery may be curative in very early stages. So if metastasis has not taken place and cancer, say for example, is confined to a particular lobe or segment of the lung, and that segment is removed, then what is happening, that the person doesn't have the cancer anywhere else and probably is cured of the cancer. So that means it is very important to diagnose cancers in very early stages. So if there is widespread metastasis, obviously surgery will not be always possible. Obviously you will try to do surgery for the primary tumor for debulking issues, that is there, but normally surgery is possible if you can diagnose the cancer early and it may be actually curative. Similarly, as I told you, radiation therapy is a possibility, and obviously there are some now very sophisticated techniques, and very pinpoint radiation therapy can be given, avoiding any damage to the adjacent cells and the intervening tissues. This is a now again very sophisticated machines that are available that deliver the radiation therapy, say for example X-rays. And then chemotherapy are the antibiotics. Now there is an important question. When we were reading our class 9th NCERT, the chapter why do we fall ill, so we said that we use antibiotics for the treatment of bacterial infections. Now bacteria is a prokaryotic cell, and a prokaryotic cell is different from the eukaryotic cell. So you can take any feature that is different between the prokaryotic cell and eukaryotic cell and use antibiotics to kill the bacteria with minimum harm to the eukaryotic cell that the human body is made up of. So that is fine. But here, when you are using chemotherapy, you are using drugs that kill the eukaryotic cell. So cancer cell is actually a eukaryotic cell. It is of the body of the patient itself, and therefore they are likely to produce some serious adverse effects. But still, a lot of advancement has been done, and in many cases actually chemotherapy is the first choice of the treatment. And because cancers generally are not diagnosed early, unfortunately, so generally a combination type of therapeutic plan is used by a team of doctors, which include a surgeon, radiation therapy and chemotherapy. So what do they do is actually sometimes, for example, just giving you a hypothetical example, they remove the major portion of the primary tumor and they finish some of the secondaries by radiation, and the remaining things are taken care of by the chemotherapy. So this type of treatment can be thought of and is normally required if the cancer is not diagnosed early. Now, as I told you, a very important development is immunotherapy. So this is very exciting. Now you know that your immune cell, if you know about cell-mediated immunity, the T lymphocytes actually are the cells that are responsible for action against cancers. Normally the response is not very high, though they try to check the growth of the cancerous cell, but the cancerous cell also finds a way to avoid the action by the immune system. So it will be very interesting to note that if there is a tumor, a malignant tumor, and it is surrounded by in the vicinity are present the T lymphocytes. Sometimes they are called as tumor infiltrating lymphocytes. So this is not for your need, just for your general knowledge. This is a very exciting development, and we say that if in the vicinity of the tumor the infiltrating lymphocytes are present, then the chances are much better. That means the body is trying to fight it. And now if you augment the function of T lymphocytes somehow, then you are helping the immune system to take care of this problem. They can actually kill cancer cells, but the cancer cells, as I told you, are trying to avoid them. So that means there are mechanisms by which actually the immune system is potentiated, so as to speak, so that it gets the potency and it gets some help in fighting the cancer causing cells, the cancerous cells in the body. And how do you do that? There would be a mechanism by which you give some cytokines, some chemical modulators that will actually modulate the function of T lymphocytes. And these cytokines may include, as your NCERT says, interferons and interleukins. You have already read about interferons and interleukins in the chapter on immunity, in this chapter on the topic on immunity. So these immunomodulators can be used. And another exciting thing thing is a monoclonal antibody. So monoclonal antibodies are called as magical bullets. Right now, this is something very experimental and normally used to prolong life in advanced cancers. And monoclonal antibodies are very specific antibodies. They can kill very specific cells. They are being used now in the treatment of the cancer. And as your NCERT says, these type of antibodies can actually be used if they are radioactively labeled. Say for example, they can be used in the early detection of the cancer as well. So a very exciting thing would be immunotherapy. The bottom line is that that cancer is an abnormality of the cell division. It is caused by multiple mutational events, and normally you will see that cancer affects generally the older people. That is now easily understood. I am talking about multiple mutations. I am talking about the decrease in the functions of the body with the age. And so for example, a person lives a very long life, is very likely to develop cancer as well. And but the bottom line is that if the cancer is diagnosed early, then all sorts of possibilities are there, and yes, it can be cured in many cases. So we actually calculate the cure of cancer as 5-year survival rate. And in say for example, colon cancer, a common cancer in the Western world, if it is diagnosed in the, say for example, first stage, the 5-year survival rate may well be over 90%. So this is absolutely amazing. So again, nothing is to be afraid of. And the thing is that the person should keep eye on those danger signals and must avoid all the carcinogens, a healthy life habit, and an early diagnosis, and this can be taken care of. I hope you have understood the topic. Now read your NCERT.